First, ITV News has been given rare access to social services as they fight to protect the country's most vulnerable children. We've been on the front line with social workers in the London borough of Lewisham, one of Britain's most deprived areas. We witnessed firsthand how rising poverty and poor housing is hitting at-risk families the hardest as staff work day and night to keep them safe. Now ITV News and the Social Workers Union has carried out the biggest survey of its kind, exposing this growing crisis. Out of more than 2,000 social workers, 80% say the number of referrals due to poverty has increased in the last 3 years. A third of children's social workers say their service has removed a child or children from their family in the last 3 years where poverty was a key contributing factor. 90% said that underfunding was seriously impacting their ability to do their job. Our investigations editor Daniel Hewitt has this special report.
The responsibility is major.
On the front line, in keeping children safe,
Is it a red?
the calls don't stop coming.
I'll just pull over just to see if it's kind of an emergency.
It's literally a social worker. How are you?
We've been given rare access to a children's social services team.
There's worries around mum drinking.
In the rooms where decisions are made,
Concerns around sexual exploitation.
How old was she when that was happening?
15 years old.
as young lives hang in the balance.
10-year-old, 18-month-old.
And for everyone, the stakes could not be higher.
Where do you think you would be if you hadn't got the help you've received here?
Most likely I'd probably be dead.
So how long have you done this for?
About 7 years.
7 years.
Lewisham in South London. We're with Yolanda, a social worker with a busy day ahead.
Literally after I came off to you, I just I left the office straight away. I'm going to meet a mother who fled significant domestic abuse.
Referrals to children's social services in this corner of the capital are up 40% since the pandemic, driven, Yolanda says, by one factor in particular.
In terms of sort of poverty, I'm getting that a lot.
So more children are being referred to social services because of poverty?
Yeah. It's not sort of the family intend to neglect their children, but, by virtue of, the family being poor, it could lead to neglect.
We've arrived at Yolanda's first visit with a mum of 4 who we aren't identifying. They're living in a homeless hostel in a different London borough after fleeing her abusive partner.
Are you feeling a bit safer since, Yeah.
Her most pressing concern is her lack of housing and the conditions she and her kids are living in.
Was some problems with bedbugs.
She shows us pictures of the severe skin conditions her young children have developed living in a shared hostel. Despite going to her doctor and help from Yolanda, she's been told her best hope of a home could be to move 2 hours away.
I don't know, nobody there. Even the kids to go or to change school and everything is start from zero.
For Yolanda, this referral is typically complicated, but the challenge is juggling so much complexity. Not long after the pandemic, she almost quit the profession.
Burnout, I feel like it's almost part and parcel of the role. I was case holding about 32 children at that time.
What ideally would you have?
Ideally, about 15.
Wow, okay. But when you've got a caseload that's kind of double what it should be, what is the kind of thing you're worried about happening?
Worst case scenario, a fatality, a child death. That's on every social worker's mind. That's something we're constantly carrying.
Poverty, health, housing, all of life's crises crisscross their way into this building.
Because we're sending the message now.
Social services here handle more than 4,000 referrals every year.
You all right?
Yeah, I'm good, thank you.
Yaz was referred when she was pregnant.
Good. And little one, how is he doing?
Yeah, he's good. He's hectic, full of energy.
She was a drug addict who has spent almost her entire life on the radar of social services.
I was a very unhappy child. Physical abuse, mental abuse, that kind of thing. I started smoking cigarettes at 9, started smoking cannabis at 10, started taking amphetamines when I was 13. I come close to dying a good few times.
Yaz had 2 children by her ex-partner in a different area of the country, but were permanently removed from her and adopted. She then became pregnant with her 3rd child, but was moved to Lewisham, where social services took a different approach.
They paid for me to go to rehab. It's the only mother and baby rehab in the country that you can detox while your baby's in your care. Obviously, they've got the support there to help you. I got chances that people in my shoes don't normally get. Do you know what I mean? It was less than 3 years after losing my other children to adoption that I found out I was pregnant with him. Although obviously, like, it breaks my heart that I haven't got my older children with me, I know they've got a good life now.
I told you we would get you there.
I know.
Today, Yaz had her final meeting with social services. Her case has now been closed.
I'm so proud of you. Thank you.
She was part of a pilot programme.
They've been left at home, mum's left because of what's happened and the abuse.
Bringing together healthcare, housing and education specialists as well as social workers to keep more children with their families. But its funding for next year is not guaranteed as the cost of care keeps rising.
But the independent review of social care recommended £2.5 billion investment in children's social care. What we've had in the budget statement is a figure of £250 million. There's not enough social workers coming through the system, but these children are children who've got very high levels of needs. And when things go wrong, they go wrong horribly. We know that nationally, some of those children will significantly self-harm. You know, in the most extreme cases, sometimes they decide to take their own lives.
As light gives way to night, Yolanda's final visit is done, but that can change in a moment.
And then we get that call that says there's a baby in the hospital, unexplained injuries. So that would be considered as red, and we're out, and it can bring us into late hours of the night.
The risks are high, but so often social workers feel like the forgotten front line.
Dan, some really alarming findings in that report, and it seems like the pressure on social services just keeps on building.
Yeah, and to an unsustainable level. And the current government, the new government, the Department for Education told us that £250 million they gave the sector in the budget is double what the previous government was going to do. And they say that the sector has been left, in its words, to fester, and it has promised to overhaul the system. Local authorities have heard this all before. Alarm bells are ringing in local authorities across the country. The rise in the cost of care, both adults and children's social care, is eye-watering, and it is unsustainable. A decade ago, local council budgets, they spent about half of their budgets on care. Now it's more like 2/3, and it is rising all of the time. Some councils fear they'll simply become care providers at the expense of libraries and street lighting and road repairs. For social workers, those in the front line, they feel undervalued, they feel underpaid, but they so often feel like they carry the can when things go horribly wrong, when they feel it's the people writing the cheques who've designed this system the way it is that should take the blame.
All right, Daniel.